Everyone, and welcome, Dr. Benjamin. Nice to see you here. Was a little bit of a last minute kind of thing to get you on here, but I'm excited to see a little bit more from what you have going on. It sounds like you have some cases, what you're going through, which are a little bit different, maybe what the norm is, and I would love to show that to the folks. We have yesterday shared a dental share file back and forth with a pretty special custom tray. I haven't really seen anything like that before. I thought that was super cool. And well, I want to maybe share my screen and show people what your website looks like, and maybe give you the chance to introduce yourself.
Okay. Hello, everybody. My name is Dr. Benjamin. I am a dentist in Las Vegas for 22 years, and I also have enjoyed doing the lab. Kind of more fun doing lab, and that's my brand. We focus on patients that want to get rehabilitated, specifically denture wearers that want to get rid of their dentures, as you can see. And our workflow is 100% digital. And so the surgeries are your basic all-on-4, all-on-X. We do use zygomatic implants. As you can imagine, a lot of times patients in their dentures, they don't have a lot of bone in their maxilla, or it's soft, so we have to rely on different techniques. And I'll share some ways that we use our workflow to capture the bite. And the brand itself is, it's kind of an affiliation, kind of like a micro DSO. We are looking to partner up with the right doctors that want to expand their surgery cases in their local towns. And what you'll be learning today is what Richard said. He's going to show you a case. We use exocad to enclose the correct wax up and the denture, the bite itself. The case that you're going to be seeing is from yesterday. We actually finished this case, and it was a really nice delivery, very fast. We used the Envision One printer. In fact, I don't know if you can hear it, but it's printing right now. Because of its accuracy, and because we like to streamline things and outsource to assistants as much as possible. So in order for that to happen, you need to have production that's going to be accurate, predictable, and you know, something where you know that you're not going to worry about the night before about the case. So that's an introduction on me.
That's awesome. Thank you for that. And then when you were browsing a little bit behind you earlier, I could see really nicely you got the Motion 2 there as well. You got a Micro 5X there in your in-house lab. You got an in-house lab and everything right there. The Envision 1, right? That's great. How's all that working out for you?
You know, I'll tell you, at first I had the wet mill, the 5-axis, and it's good. It's a good workhorse, and yet I needed something else. So Jesse from Opulent, he calls me up and says, "Hey, we got another machine for you. Do you want it?" And I'm like, "Well, what's wrong with it?" You know, because dentists were like, "Okay, somebody's doing something. Somebody's trying to sell me." He's like, "Look, it has like 100 hours. It's not a big deal. Take it. We'll warranty it." I'm like, "I would love it." So now it's sitting right here. I'm going to turn the camera. It's sitting right next to me. Can you see it?
Actually, I'm gonna stop the share so we get a bigger picture of it. Yep, that's awesome.
So, and then behind me is the other one. Okay, and then the Envision one printer. But, and now this is my go-to. This is the milling machine I just love. It sits right next to my computer. And it's just one of those things, we can mill and we can print at the same time. And the wet mill is really nice. We milled a framework. As you know, I asked for your help. That required wet milling strategy. And the dry mill is excellent because we can do a lot of fast turnaround with patients, which I love. So.
Very cool. Well, let me show maybe my screen again, and I'm gonna show the files what you send over, and maybe we can chat about those a little bit. Screen, there we are. And I started kind of loading them in, and then I was like, well, why am I doing this? Maybe I'm boring someone when I'm showing how to load the files into the software on how it's being set up, but maybe not. Maybe somebody wants to see how that actually works. So let me open my Exocad. And
I want to give an introduction to a very amazing doctor that I've befriended. His name is Dr. Dan Rosen. It's actually his creative mind that developed this protocol, and he calls it the Rosen tray. So all the kudos to him and his amazing technician.
That's fantastic.
I'm forgetting his name. But I learned a lot from what he would post on Facebook, and I'll teach you some of my strategy. He may be a little bit different. He does train people. So the custom tray, again, is for a case where you're going to be extracting, for instance, all the lower teeth, and then you're going to need to somehow reference things during the surgery, the bite, and that's what we're going to be showing you.
So that might maybe seem like a dumb question, but is he making a Rosen screw?
Yes.
All right. Seems very popular.
So Dr. Rosen is a very gifted person. He doesn't know it himself, but he's funny. He teaches for Norris Medical zygomatic courses. He taught me to be more comfortable doing the surgery. So to me, he's a really great doctor and should be referenced and credited for this workflow.
Oh, that's awesome. Okay, so maybe here's a little bit more of an idea of what this is all about, right? So when I got to tell people, maybe when I first looked at this yesterday, I haven't quite seen something like that before. Nobody has asked me to make something like this before. I did had the request before of making teeth on top of a splint, having an occlusion on there for whatever the purpose is, let's say as a temporary mock-up to see, if the patient tolerates opening the bite to a certain extent or whatever, but not as a custom tray. And I thought that was super interesting. And the teeth what we're seeing here are from a wax up, to maybe clarify that. So if I am going and showing a couple of other files here, here's an wax up design merged together at the correct position with that denture. And of course, that's also a summary here available individually there. And ultimately, I guess you can design the splint. It's actually one of the videos of what I made maybe 2 sessions ago. Very briefly touched on how to make a custom tray with the software. So basically, when you're setting it up, you would, if you don't see it, you want to make sure you have the correct work params, and then otherwise maybe change it. If you're working with Ceramil, there's a splint option there. And on the Ceramil option, it looks a little bit different. You don't have these selections here as tabletop US anatomy from tooth library. It's just basically standard, and then you have your bite splint or bite splint missing tooth. You could get from us the work params from Galway, or get it from a friend and then patch that on the correct place. And then you also could theoretically just design the teeth on there. But in this case, the wax up was already created, right? And then you could use the attachment tool to set this up. So you just say standard. And I'm going to maybe let you explain a little bit more when I bring the tray back in on what's important here. Can you tell us a little bit more about it?
Right. So imagine that you have a sedated patient. By the way, can you remove the wax up from the tray?
Yes.
So okay, so that's the tray right here. So everybody needs to understand that this is the inside. So let's flip it around, and let's yep, this is a good view, and bring the antagonist on top of it if you can. All right, so can you solidify the view of the antagonist so we can see it? I'm going to explain to you. Okay, so getting back to my story. So imagine that you are treating a patient, whether you got a nurse anesthetist, an anesthesiologist, or an oral surgeon watching this, and the patient obviously is sleeping. They can't get the right bite even after you wake them up. In our case, we use propofol, so they come back very quickly, but it's still to depend on them to be alert, to bite into the right the right way is going to be difficult. So we've tried doing that, and it fails all the time, because the patient comes the next day and they say adjust the bite, so it's just more problems. So if you look inside and zoom in a little bit, like in the lower right side, you'll see interlocking mechanism that you have 3 points, right? You got on that point, then if you turn the model, you have in the center, and then on the side, okay? So these are 3 points. And if we go back to our geometry days in high school, how many points determine a plane? 3 points, right? 2 points determine a line, and 3 points determine a plane. So we need to have that type of definition. In order for you to have the same repetitive bite, we need to have 3 points touching. So if I'm going to do a wash and I'm going to put this in somebody's mouth, okay, visualize me putting it in, they're sleeping. All I got to do is put them in the bite that corresponds and locks in with the antagonist. There's no guesswork. So that's number one. Let's look at the intaglia. Now this is where I get a little fuzzy messages from Dr. Rosen. He says he doesn't need the vertical stops. I don't know. He may make a comment on this video. I'm not sure. But I've decided myself to put 3 stops. Okay. This case, the patient had partial teeth. I had to edentulate him, just remove everything. So there's really no reference where the tray stops. You can have your depth of your vestibule as the acting primary as well. And also, if you're doing a bone reduction in the front, you're going to lose that vertical dimension, the VDO. So this is one of those things where it's also surgically kind of driven. If you're going to be doing a lot of bone reduction, then you're going to rest on the vestibule because nobody's really cutting the vestibule. So the border of the tray is very important because it also creates a stop. So sometimes I remove those internal vertical stops if my multi-unit is resting on it. So it's kind of like a safety precaution, but I always design it with the 3. And the 3 are geometrically, they're positioned one in the center because I know I don't put an implant there. And I put the other 2 far away up on the ridge because I look at the CAT scan and I see where the implant's going to come out. So if you look down on it, you'll see that it's I'm going to terminate my implant in the premolar, the 2 premolar area. So that may be something where, exactly, that's good that you're showing us. So where I put those vertical stops, that is dependent on where I'm going to be ending my implant, so it doesn't get in the way.
Yeah.
And the third thing about this tray is the windows. So the windows are important to me. It's how I know that everything is seated and the impression gets squeezed out of there. So, you know, it's just one of those practical things. I just need to see what's happening. You can print this in, you can print this tray in clear material, like a guide material from Desktop Health. And you can see everything, but I still think you need to have those venting windows.
Mm-hmm.
So to summarize, you got the interlocking 3 points. You have on the intagli, you have the vertical rests in addition to the custom, the borders. And then the windows, to me, that's important. And a minor thing is the handle. Obviously, you need the handle.
Yeah. Awesome. I'm really liking this. I'm the only question I'm having is, and you kind of already answered it by saying sometimes you trim them away or something. That's if you're placing the implants and if you're flapping and suturing everything up, eventually it's ending up on a different position, I guess, where it was anticipated, and you might have to maybe grind them a little bit to get them right. But if you have the vestibule and everything to help you there, then I would assume that's all not an issue, and rather have them there, I guess. And if they're in the way, grind them off. Yeah. Right.
Yes, and that's what we do. We always have an acrylic denture bar next to us when we're doing the surgery, so everything's ready. Versus, you know, trying to put something that's missing, we try to remove something that's printed. It's just a fast action, right? Yeah. Otherwise, if I don't have the vertical, I don't really know how. It's a mystery for me. Maybe somebody can answer it in the comments, but it's a mystery. If you don't have a vertical stop, where does that tray literally stops? I mean, where do you, what's the mechanism? That's where you lose your VDO.
Yeah.
And that's where you may create a temporary that's going to be shorter, you know, and patient smiles, you can't see the lower lip is hiding the teeth. You know, then you're going to have to redo the case. So that's one of the ways that we do it. There's also another alternative, but that doesn't include the tray system. That's for another webinar, where you strategically keep certain teeth in the stereophotogrammetry workflow to capture and reference things, but that could be a different webinar again.
Yeah. And then how much importance do you see in having the actual teeth of the proposed wax up? Like, meaning when I'm looking at the ideas of how I now would come up designing this, I've basically 2 options. I could if the proposed wax up was already designed, of course, I can use the attachment tool and then make a Boolean and combine these two, the tray what I designed and the wax up, or like it was in here on the database, what I showed, the tabletop use anatomy from tooth library, I can basically just use the chain mode and set something up and then adapt the occlusion. Does it matter to you at this point?
Yes, it's very important. That's basically taking out the DNA of this thing. So a lot of times during surgery, you're trying to put all the pieces together, and you know, I need as more visualization in the wax up in my hands. And when I put the two arches together, remember, patients are sleeping most of the time. They could be nasally intubated. I'm not waking them up.
Yeah.
So I need to manually put their arches, you know, put the mouth together. And I need to see sometimes, well, all the time, how the teeth that we have designed, how it all comes together.
Yeah.
So I don't want to use a library, and I don't want to use, you know, a custom tray that doesn't have all this, because your midline can be off. I've had situations where I had to pull off the PVS, the Improgum, like I use Improgum for this. I would take it out because the way I positioned the two jaws was not right. I didn't lock it in, meaning when we first started designing these cases, we didn't have these locks on the antagonists. We had it free floating, meaning, you know, like what you see right now, the indentation on the handle. Do you see that in? Yes, right there. And also on the handle, do you see the indent? Yes, that's the front teeth where they come. All right. And we didn't have that when we started doing this stuff. We didn't have this mindset. So imagine now that you've lost, you just did a custom tray with those locking mechanisms, but you don't see the teeth. I just feel like it gives more information to the doctor.
Yeah. I like it. Yeah, that's great. I can totally see the how that's making life easier. And yeah, thanks for answering the question. That's of course makes sense if you already see how things could maybe come together. How I mean, obviously you don't see the necks of the teeth here because you need some room for the tray. But I guess you can get a first impression on how things are going to look. Yeah.
Also, I want to put in just another thought. Remember, if a patient comes another day and they're not sedated, I had a case where I just couldn't fit the dent. The teeth were off. Well, because I preserved the bite, and now the patient is conscious, they are alert. You know, remember, I'm fighting people that, you know, they're in a sedated mode. I have to find that perfect video. I don't tell them close, and, you know, but perhaps there could be a case you save this bite reference. It's rigid, it's static. You can always come back a different day, you know, apologize to the patient. Listen, I'm sorry, we didn't get it right. You take everything off and take a nice bite impression and make sure that the antagonist locks in, everything's right, you know, and you can just remake the temp. The point is that this bite is forever there, and the teeth design and the wax up is also there. So it kind of is helpful, you know, even for second time around.
I like that. Do you want to, should I give the host over to you? Do you want to show the other case, what you mentioned in the beginning?
Right. So this is a case where you have a edentulous case. And I have one where it's a double arch. What to do then?
Okay, awesome. I made you the host.
Okay. If I can find it now, hang on.
let's just look, and I'm going to see if we have any questions so far from folks or not. That looks like nothing's in the chat right now. And I'm going to check really quick what's going on Facebook. I know Holly is going to look out as well for some of the questions, but we're streaming on multiple groups and places at the same time. So we'll see. If I can't get to questions, etc., if I'm missing something, you can always email it over to richard@opulentcadcam.com, or just feel free to, whatever platform it is, drop your comment there, your question, and I will eventually see it.
So this is a case. Can you see the screen?
Not yet. You're going to have to say share screen one more time. There, now it's coming up.
You see it?
Yes, now I can see it.
So this is a double arch case. This lady's gonna have double zygoma. We're gonna go into the intranasal canal right here. Put maybe 5 implants here, and then she has 2 locators. We're gonna convert this into an all-on-4 on the top, all-on-5 on the, I'm sorry, all-on-4 on the bottom. She has these 2 locators, you can see, and then all-on-5 on the top with zygomatics. So in this situation, again, the patient is sleeping. This is how I envision the case. Like, after the surgery is done, what do I have to do to take the perfect impression? So we start out with waxing up the ideal denture, top and bottom. Mm-hmm. And then we turn it into a custom tray that's bullion. So it's basically, it's all attached. I cannot separate this thing.
Yeah.
So I'm going to use the pallet to stabilize the top. Mm-hmm. Okay. Yeah. And then I'm going to put the mandible right into this position. So because the maxillary arch doesn't really change, right? The palate stays the same. Mm-hmm. The lower jaw goes up and down in all XYZ axis, right?
Right.
So I'm pivoting against the palate. So the way I would take the impression on this situation is, again, stabilize using the palate, this tray, and then close the mandible right into it. Mm-hmm. Okay.
I like that it's one piece and can move around. Yep.
Yes, and we've also raised the intaglio right here. We've raised it high above, right into these teeth. So imagine the multi-units that are going to be sticking out. There's going to be no interference. Like, remember we had the 3 stops there? Here we don't have it.
Right.
The reason why we don't have it is we're going to be using this in this surgery. I'm not going to be changing the depth of the vestibule. So there's going to be a vertical stop, mm-hmm. Positioning the jaw. And it's going to stop right at the point where we want it to stop because of the maxillary, the palate. So right. It all comes from the palate, managing, stabilizing the maxillary arch. And because it's all fused together, we have, a complete set.
I like it. How do you since we're like on this and we're looking at basically an established VOD, any tips or suggestions when you are opening the bite, what's maybe to consider if the initial situation where the patient walks in is not ideal, and you can already maybe tell right. there's more room needed, or etc.
Right. So I hear great news. Holly may be introducing a facial scanner mm-hmm. In your company, which is a must thing. This design was incorporated the increase in the VDO. Most denture wearers, they have collapsed bite because with bone resorption, most of the dentures don't fit. In addition, you can't just carbon copy an existing denture set because of worn dentition. So you have two things happen. You got bone resorption, which affects the intaglia portion or the fit of the denture. And the second is the worn down dentition, meaning when they bite down, right, it's lower than it should be. So we got to increase it. So how do we counter that? We tell our technicians, designers to increase the VDO, you know, whether it's going to be 1 millimeter, 2 millimeters, and then also look at the facial scan that we import into exocad. And from that, we will do a try-in session. So what you're looking here is actually going to be a try-in appointment. We're going to print this and bring the patient in and have them do a smile and see where the gum is, the teeth, how the midline is. If we have to change anything around, we're going to modify it and do another try-in until everybody's happy. So we set the stage utilizing the facial scanner, the VDO that most of the time needs to be increased, generally speaking, and also doing a try-in and making sure that what we get during the surgery is what the patient agreed to during the try-in.
Good. Thanks for clarifying that. Well, yeah, facial scanners are definitely something what is helpful for the technician as well. I would say to be able to pick a tooth library and then at least have a starting point. And I guess probably almost everybody would agree the tooth library is only a starting point, and then you're tweaking it from there, right? Hopefully, at least. And being able to find something what is going to match to the personality what the patient brings with. If you have pictures, if you're lucky, great. But the picture doesn't rotate, as you know, so you always have you have to revert back to your facial view, basically. If you have a face scan for it, and being able to turn the patient to the side around and get that perspective, etc. I think it's very helpful. And they definitely came a long way. So exciting to watch what's happening there. I don't know. I'm gonna see if there's any questions maybe somewhere. And I don't know exactly if you have any other topics or things, or if you wanted me to show maybe something on the exocad. I think maybe doing the entire design of one of those custom trays would maybe be a little bit too much, but folks of course can reach out to us, and we're happy to walk you through and how you could come up with a design like this. But in essence, you're designing a splint. We're using the splint module, and you might have to enable the checkbox for the design on palette if you have the maxillary where you're designing that, and you're merging it using the attachment tool, your existing wax up on the correct position. So you might have to export a couple of files from your initial wax up proposal so that you can utilize it as a bite, and you can make a pick point alignment, if that makes sense, a 3-point alignment in exocad. And then everything ends up on the correct position, and the vent holes are also with the attachment tool. Handles are available. I have somewhere a collection of a couple of different handles. You can freeform a handle, but they come out nice if you can using a pre-made handle. And you can, there's tons of them out there on the internet, and you could probably custom design one if you wanted to.
And also, if there's somebody that wants to just outsource the design, I have somebody that we use. Let's say, you need it done. I can connect you with the right person. If you want to, find the right person, we have it.
That's awesome. Wonderful. Yeah, I think that was fun to look and discuss the case. Like I said, I haven't really seen anything like it. I'm not sure if somebody else can see comments or questions. I don't really at this moment see any here in our chat. There's a couple of Facebook notifications, etc. But I'll eventually have to go look at those a little later at a later point. But that's awesome. I really love your website. I love the before and after what you put together there. That's super cool to play around with those. I always like those patient before and after pictures. And I hope it's not going to be too long when I can meet you in person.
Thank you, Richard. And hopefully we'll have some events together. And again, if anybody wants to get in touch with me about maybe a possible affiliation, it's a wonderful, this treatment of patients. It's my favorite, changing people's lives. I mean, besides like all the technical stuff that, the handles and attachments, at the end of the day, that is such an amazing feeling. And you guys are also a part of it, being vendors and being so helpful. It's such an amazing feeling. This is why we went to dental school, really, to change people's lives. And denture wearers so far have been the greatest, I would say, phenomenal patients when it comes to a total life transformation. When you get somebody that can't smile or kiss their grandchild, and you give them these like amazing teeth. And this is all because of the disruption that's happening in our industry, which is at such a fast pace. It's amazing. I can't get a hold of it. Like, it's moving so fast. So I want to thank you guys for making it happen, because training dentists is very difficult.
We have a tight schedule.
And also everything that I would say to the technicians that make it possible, we cannot forget about them. Amazing culture, amazing people. I think overall we have a great team of people. Everybody's trying their best. So that's what I love about this industry. So I'm very excited going forward.
Yeah, same here. I remember that on my very first denture try-in setup, and the lady had like a super old pair of dentures, and during my education in Germany, setting that up, the lady and the try-in started crying. And I think, most folks have one of those like key moments where they are remembering it of a certain patient or somebody where it's life-changing, like you're saying. That's what it's all about. It's awesome. Well, thank you very much for coming on here, and thanks everybody who watched this and joined, and I see you next Friday. Take care, guys.